Welcome to the Sleep is a Skill podcast. My name is Molly McLaughlin, and I own a company that optimizes sleep through technology, accountability, and behavioral change. Each week, I'll be interviewing world-class experts ranging from doctors, innovators, and thought leaders to give actionable tips and strategies that you can implement to become a more skillful sleeper. Let's jump into your dose of practical sleep training. Welcome to the Sleep is a Skill podcast. My guest today is Brian Curtis, Ph.D., and is a clinical psychologist and the founder of Honest Sleep, LLC, a telehealth-based clinical practice specializing in the assessment and treatment of chronic insomnia and nightmare disorder. He has over 12 years of research experience in the field of sleep medicine and is a member of the American Academy of Sleep Medicine and Society of Behavioral Sleep Medicine. Dr. Curtis received a Ph.D. in Clinical Psychology and M.S. in Human Genetics from the University of Utah. Dr. Curtis's work includes targeting comorbid sleep disruption for individuals diagnosed with borderline personality disorder, post-traumatic stress disorder, anxiety disorders, and depression. As sleep disruption is transdiagnostic across most mental health concerns, Dr. Curtis is particularly interested in helping fellow therapists increase their competence in the assessment and treatment of sleep-related difficulties with their clients. Really helpful conversation that we get into today, and a lot of practical tips and takeaways. He even does an exercise with us right in the podcast. So please engage in that, of course, if you're not driving or what have you. But I think you're going to really get some immediate takeaways and some new strategies and ways to look at this world of sleep and how to really gain power in this area. So I get a lot of questions around sleep supplements, and I'm very hesitant to just throw out a whole laundry list of possibilities. One, I don't think it's the most responsible thing to do. I really do believe in testing to see what types of supplements make sense for you. And two, because I really truly believe that most of the things that you can do to improve your sleep are behavioral, psychological, environmental in nature, and often don't cost a dime. However, there is one supplement that I personally take every day and that I do feel quite comfortable with suggesting for most individuals to experiment with because of a couple of reasons. Its high safety profile and high rates of deficiencies in our modern society. Some put the numbers as somewhere around 80% of the population being deficient in this one area, and that is magnesium. So magnesium has been called the calming mineral, and some report that magnesium can increase GABA, which encourages relaxation on a cellular level, which is critical for sleep. Magnesium also plays a key role in regulating our body's stress response system. Those with magnesium deficiency usually have higher anxiety and stress levels, which negatively impact sleep as well. Now, before you go out and buy a magnesium supplement, it's important to understand that most magnesium products out there are either synthetic or they only have 1 to 2 forms of magnesium, when in reality, your body needs all 7 forms of this essential sleep mineral. So that's why I recommend a product from my friends over at BioOptimizers. They have created something called the Magnesium Breakthrough. And taking this magnesium before bed helps you relax and wake up refreshed and energized. And while we don't recommend that you go too nuts on looking at all the sleep stage classifications on all your wearables, I will share anecdotally that many clients have reported improvements in their deep sleep trend numbers. Again, I don't want you going nuts on the sleep stage classification numbers on your wearables, but I do want to let you know about that because I know that many of you do reach out on questions of how to improve your deep sleep. So I also love that BioOptimizers offers free shipping on select orders, and they offer a 365-day money-back guarantee on all their products. Plus, they have a customer satisfaction rating of 99.3%. Very impressive. And you can get 10% off Magnesium Breakthrough. Again, this is the same magnesium that I use every single night. And finally, you can get 10% off Magnesium Breakthrough. Again, that's the magnesium supplement that I use every single night by going to www.mag MAG. So magbreakthrough.com/sleep is a skill. And be sure to use the code sleep is a skill for 10% off. And welcome to the Sleep is a Skill podcast. Dr. Brian Curtis, I'm really happy to have you here today. This is really a pleasure. I know we got connected on a panel that we have done around mental health and sleep a while back. So to be able to have the opportunity to go in deeper with your knowledge is really just an honor. So thank you so much for being here.
I am honored to be here. I've been looking forward to it. Thank you, Molly.
Oh, awesome. We had an opportunity to speak a bit before we hit record. And a couple of things that we spoke to that we're hoping to hit on today is the big topic of anxiety and sleep and potentially some tools or strategies of how to approach that. But I know you've really made it your business to explore that in depth, both it sounds like in your own life and then with the many, many patients that you've worked with on this topic. So I'm going to kind of put it on to you to share a little bit about maybe your background and how you found yourself really specializing, particularly in that area of mental health, anxiety, and sleep.
Yeah, thanks. And so the way I found myself, it was almost by accident. So this topic of, sleep, I've struggled with chronic insomnia for 21 years. I mean, at least since the age of 10, I was the kid at the sleepover awake at 2:00 in the morning, just watching my friends sleep. Sometimes the memories of walking home with my blanket, just super sad, not being able to sleep.
Yes.
And just lifelong, what we would call generalized anxiety, which is the flavor of anxiety that it's not a phobia. It's not, I can't go in elevators. I'm afraid of dogs. It's that kind of constant chatter for me in the mind. It's planning, it's worrying. And I would later find out this just runs in my family. So my mother, my 3 older brothers, this is our flavor. It's planning, it's perfectionism, it's anxiety, and it happens to be chronic insomnia too. And so this has been with me for the majority of my life. And I stumbled into this field of sleep medicine that I knew nothing about. I was in college and I wanted to shift from this kind of daytime corporate day job that I had. And there was a position for a research assistant at our local university sleep center. And I almost didn't do it. The medical director, Dr. Chris Jones, he's a sleep neurologist. He left a message on my voicemail and I listened to it. And he's, this is Dr. Jones, and very somber. But he mentioned the term circadian rhythm. And that brought up an REM song that I liked called Day Sleeper that talks about circadian rhythms. I'm like, I don't know what those are, but I like that band. And so that gave me the prompt to call him back. And then I got introduced to this whole field of sleep medicine. And then I could reflect on, hey, this has been my whole life. And I had no idea that, the gold standard evidence-based treatments for what I was struggling with, these are skills-based. They're not pills-based. And so much of my life was trying to find that kind of quick fix, right? The sleep meds, antihistamines, alcohol was one that I didn't even realize I was using for both sleep and anxiety. And so that really launched this whole path to then being trained in neuroscience and genetics with the research we were doing, and then ultimately to this field of clinical psychology and being a specialist in what's known as behavioral sleep medicine. And that's all about the skills-based tools for how do we deal with and optimize sleep without the use of medication, although those can be useful as well, which we can talk about.
Sure. Wow. Well, thank you for that background. And then, I'm so glad that you liked that band and that you had that kind of
It's all about REM. That's my whole life story. I owe it to Michael Stipe. Thanks.
Fantastic. Love that. Okay. So that's kind of the background. And I know you're particularly passionate to your point of what you've shared, how it's worked into your own life, and then how you've been able to make this connection for the patients that you're working with. So if we just start at the beginning and kind of the ABCs for people listening, presumably if they're listening to this podcast, they're either struggling with their sleep or looking to up-level their sleep. So if you can kind of walk us through how anxiety and sleep might be interconnected or anything we need to really know, kind of start us at the beginning.
Yeah. And so anxiety is one thing we talk about, but anything that has this flavor of what we can call hyperarousal,
Yeah.
which is our stress is just high. And so if you find that during the day you have elevated stress, and a lot of people I work with, it's that pre-sleep period where the mind starts racing with anxiety. But also if you have a trauma history, post-traumatic stress disorder, this can be just your kind of baseline, is that hyperarousal state. And so anxiety, chronic stress, these things, they do what's called masking sleepiness, which is they kind of sit on top of underlying sleepiness, kind of like a mask on our face. And so a primary tool that we want to think about when we have high anxiety that's not often covered when we talk about treating something like insomnia are these evidence-based tools for how do we manage ongoing chronic stress, right? And so how do we unmask this underlying sleepiness to even give our brain a chance to recognize that we have this sleepiness? Okay. And so there's a number of evidence-based tools to do that. And we can walk through a few of them, but that's one of the primary drivers is if you're dealing with anxiety, if you're dealing with trauma, low mood does this as well. It's kind of sleep is what's called a transdiagnostic factor, meaning that if you're struggling with your mental health, chances are sleep kind of comes along for the ride. And a really important research finding is unless you target the sleep disruption directly, it's unlikely to go away, even if you successfully treat the other mental health difficulties, the anxiety, even PTSD. Sleep tends to break off and become its own little monster that requires its own direct intervention.
Well, thank you for clarifying that too and providing a bit of that kind of vocabulary and ways to understand this. Just quick check-in for anyone that might be listening, and certainly anxiety. I'm so glad we're discussing this because anxiety and sleep disturbances, as we know, often go hand in hand. Just want to underscore your sense of the future for someone dealing with this. If you can just help us kind of share that while it might be like that for someone right now, if you can then walk us through some of these tools and also provide us with the comfort that there are things that we can do about this, because I think so many of us, and certainly, I think my backstory, that I went through my own period of difficulty with my sleep. And one of the biggest things I was often looking for, just, kind of the success stories of showing that people can work through these things. And while, you might have a proclivity to certain ways of being and certain patterns, that there are a lot of things that we can do. So just the underscoring and checking in, and so that people are committed as they listen to all these tools, that they're not just kind of like surviving it, that they can thrive throughout this.
Are you saying that my previous answers were just a bummer, Molly? Is that what you're saying? No, and now we'll shift to the hope aspect.
Not.
And
to underscore.
That's right. This is really, really important though. And this is why in the work that I do, it almost sounds to a lot of people almost too good to be true. And so we'll talk about the tools. And when we're talking about, let's say, insomnia, which is difficulty falling asleep or difficulty staying asleep, or difficulty waking up earlier than you want to, and it's hard to get back to sleep. The gold standard treatment is something called cognitive behavioral therapy for insomnia, or CBTI. And it's this multi-component treatment. One of those components is let's target hyperarousal and anxiety. But this tends to work on average from 4 to 8 weekly treatment sessions. And so I've seen people who have come to me and they've been struggling with this like me for 20 plus years. And within a matter of, really 6 weekly sessions after I meet with them, they're sleeping on their own. This isn't, they've been on, let's say, sleep meds for years, if not decades. And once their sleep schedule is stabilized, we can gradually taper those down in coordination with their medication prescriber. And so a real benefit to this treatment is it tends to be highly effective and it tends to work very quickly. And that's with saying, though, an important factor here is why is the insomnia happening, and making sure it's not some other sleep complaint. I know you've talked about sleep apnea on the podcast before, circadian rhythm disorders. And so making sure this is what we're looking at, let's say in this case, insomnia, There's definitely hope. It's highly effective, but we really want to make sure we know exactly what we're treating. Yeah.
Well, thank you so much for framing it that way and also being thorough in the fact that sleep is not, top 5 tips type of article or something. It's really, to your point, requires that really leveled and layered thinking to get at what are we dealing with here, but certainly coming from that place that there's so much we can do, and the high effectiveness or the way of approaching it, certainly with some of the results for CBTI, looking really, really promising. So without further ado, yes, please share with us some of those tools that you found to be effective through that lens.
Yeah. So one of them that is great, and we have it because we're always doing it, focuses on our breathing. Okay. This is with anxiety. This is with chronic stress. And so for the listener, we're going to have to do this verbally. Molly, you can see me. If you take your index finger, go ahead and just in kind of the middle of your neck on the side, kind of between your chin and your jaw, go down and find your pulse there on your carotid artery. If you can feel that kind of heartbeat, you got it?
Got it.
And so we're not going to change anything that we're doing. Just breathe normally and just become aware of what your heartbeat is like in this moment. Okay. So that's the heartbeat at rest. And now what I want us to do, there's no fancy counting of breathing, but just breathe normally through your nose. And then on the out breath, just try to elongate the out breath slightly longer than the in breath. You can almost kind of imagining emptying your lungs, not to the point of where it's uncomfortable. And then a normal breath in and the slower breath out. And as we do this, Molly and dear listeners, just be interested in, does the heartbeat change? Does it get slower? Does it get faster? And is it on the in-breath or the out-breath? And I don't know, I'll rely on you, Molly. Whenever you notice anything, is anything coming up for you?
Yeah, I really appreciated the kind of general instructions to extend the out breath versus the specifics of count to this, do this. Because I think for a lot of us that can run more anxious, the strategy of getting it right can take over. So instead of that, I really appreciated that I did just see that naturalized kind of elongation of the process of how long that took for the pulse rate to kind of slow. So that was very nice.
And like you're mentioning with anxiety and with people who are really high achievers, I want to do this right. Yeah. Counting can be very stressful, and they notice their heart rate increases when they focus on breathing. And so the mechanism here is, if you're wired up like I would expect you to be as a human, our in-breath is paired with a branch of our automatic or autonomic nervous system called the sympathetic nervous system, which increases heart rate. The out-breath is paired to that kind of brake pedal, the parasympathetic, and that slows the heart rate down. And so if you're noticing you're anxious, especially around that pre-sleep period, taking a few deep breaths and especially elongating the out breath, that can put you in more of that sleep promoting state. And this just isn't for sleep. This is during the day too. If you're anxious, if you're worried, that's one evidence-based tool. We can call it paced breathing or diaphragmatic breathing. And that can be something that clinically we use all the time because you're breathing anyway. And so now knowing the mechanism of what is kind of driving that can be useful for anxiety. So breathing is one strategy. Questions about that? We locked in? We good?
Yeah, that was great. Thank you for kind of starting there, because it's arguably one of the most important places to begin. So thank you.
Nice. And so a second one is for a lot of people where worries start to come up, our anxieties start to come up. And I definitely noticed this in my life, which is I would be kind of nodding off on the couch before bed. I had a lot of sleepiness. But as soon as I started heading towards the bedroom, right, in bedtime, that's when the heart rate increased. And that's when the thinking started over and over, that rumination, right, of the thinking. And so one way to approach this, there's multiple ways, but one way is to actually, before bedtime, an hour or two before bedtime, is to get a piece of paper and a pen, or type it out if you want to, but actually write out all of these worries, these things that you're lost in the future planning about. And so we're getting them out of our mind onto paper and then engage in some problem solving. Can anything be done about this? Hey, this is my schedule tomorrow. I'm going to be meeting with Molly. Is that stressful? Well, not really. I like Molly, but is there something I need to prep for? Yeah, there is actually. I want to get my thoughts together. And so if those thoughts come up in the middle of the night, not right before I'm sleeping, because that can be stressful, but an hour or two before, we're writing these worries down, we're problem solving. And so that way, in the middle of the night, when we have those worrisome thoughts, we actually have already written it down, and we can give ourselves permission to kind of let go of problem solving during the nighttime. And we can remind ourselves, hey, we're probably going to be more effective after a solid night of sleep than at 3 o'clock in the morning anyway. So we have breathing, we have writing out stressors, which can be, useful. You can also keep a little notepad by the side of the bed to jot things down. So a related point here is if you find yourself ruminating, tossing and turning, and it's hard, the sheets are getting warm, a real evidence-based tool is when you notice that effort to sleep. The clinical term here is sleep effort, is just physically getting up and out of bed. Okay, breaking that learned pattern of the bed and the bedroom are now the place for worry and stress versus relaxation and restoration. And then once you're out of bed, you can engage in maybe some paced breathing, maybe some meditation, maybe some gentle stretching or yoga, whatever it is to get that heart rate down, back in that sleep promoting state. And then you try again. Back to bed. We don't have that effort. The, pillows cool down, kind of hitting the reset button. That's another evidence-based strategy for how to deal with this kind of chronic cycle of anxiety-induced sleep disruption.
Excellent. Do you have any advice for people when they discuss the fact that they find themselves now hypervigilant of how long they've been up, starting to assess, am I sleepy? Am I not? Is this working? Does this make sense to go back? The frustration that comes, all of this kind of inner chatter, any way to kind of work through that?
Yes. And so the general guideline we can say in sleep medicine, like if after 15 or 20 minutes, you're not falling asleep, getting up and out of bed, the problem with the patients I work with anxiety is, well, now I've got a laser beam on the clock and it's only been 13 minutes and the anxiety is up.
That was me.
And so was that you?
Oh yeah, that really tripped me up, that one.
And so I have an idea. I'll just ask, what actually worked for you then? If you were watching the clock, what was useful for you?
So and this was quite a journey, a number of things came in. So it was very layered, but eventually one of the things that started to make a difference was the linking up that during this time wasn't just totally wasted, that there was, even in that kind of restful state of laying horizontally, there was different ways that I went through this, but eventually getting that I was getting some sort of restoration in a particular way that started to bit lower the anxiety. And over time, with many, many other tools, I started to loosen the grip of the trying, that all that efforting. So it was a kind of internal shift in the narrative and thought process, but that some other things that happened.
Perfect. But that shift is so critical because often the way I'll frame this, there's a number of skills in CBTI, but when you combine these together, it can end up that, well, maybe you're going to bed a little bit later than you normally would to build up that sleepiness. And right, if you're maybe not watching the clock, for some people, I actually have them turn it around or move it across the room. And we're just going to rely on the physiological signal of sleepiness and differentiating that from something like tiredness or fatigue. But so we're using our body's signal to guide when we get in bed. But even if we do that a couple of times a night, let's say we get up and out of bed, it takes 10 minutes now to feel sleepy again, 15 minutes, we go back to bed. Hey, it's happening again, right? And I'll have patients say, but what if this happens 2 or 3 times? This dovetails with the critically important tool of monitoring our sleep. Okay, so if they're doing a sleep diary or a sleep log, which they absolutely will when they work with me, it's the golden ticket of sleep medicine. Yeah, we can actually look and say, well, based on your last week, it looks like you're kind of awake for 2.5 hours anyway to fall asleep or during the night. And so that shift of it comes from viewing this as a drag and at least I'm laying down to rest when I'm in bed. Well, if you're resting but still trying to sleep, we're still learning this connection that the bed and the bedroom is a place for trying something instead of allowing sleep to happen. And so part of the way I describe this sometimes is we're giving you the gift of an hour and a half of time that you didn't have. And so what would you like to do during that time if we're staying up a bit later? And now they're engaged in some values-based activities. Maybe it is relaxation. Maybe it's journaling. Maybe it's some light reading. but it's not in the bed. It's not in that space. So yeah, that kind of shift that happened for you with multiple things, that is a really big part of treatment, is viewing this as something we need to keep doing and adding to eventually. That's what makes this so challenging with anxiety and insomnia. It's why meditation is so hard, is it's actually about skillfully doing less, not about adding a whole more, but it takes learning skills to do it counterintuitively.
Absolutely. Interestingly, for me, a bit of a fringe element in that one of the things that did help make a difference was, if you're familiar with ACTI, acceptance commitment therapy for insomnia, kind of using some of those kind of practices, because I was actually starting to get so fixated on the whole fact of I can't be in the bed unless I'm only sleeping, and the sleep and sex element. And oddly, counterintuitively, after all that hype, to be able to kind of just get that there was an element, there could be time and a place to also be in the bed to relax and do some of this kind of breath work and calming practices. So much of that over strategizing, very much the hypervigilance that you're speaking to. So I just appreciate that you're walking us through this, because it's not so cut and dry. And there are often times where you're going to try and bring in a number of these things and compound them over time, and you will get better and better at these things.
And I love that you're saying that, because oftentimes, people have been handed a handout that says sleep hygiene on it. And it's kind of like it's etched on tablets that thou shalt not have caffeine or alcohol after this time. It's these rules, but what you're pointing to is this flexibility. So if people getting up and out of bed is stressful, what I care about as your sleep clinician is I care about what works.
Yeah.
And so we're going to make this highly individualized. And so for Molly, getting up and out of bed might not be the most useful tool. It has evidence that it can be useful,
sure,
but we're looking for what works for you. And so, having that ACT, acceptance and commitment therapy, maybe we do this while we're in bed, but we're tracking it. And so we know that's useful for you. And that's the really fun part about doing this work, is it's so highly individualized based on people's backgrounds, their treatment goals. And that's the process of discovery, to make sure it's not just we're going to go from step 1 to 2 to 3, but it's going to be about you as a person and working with the specific things that are getting in the way of that restorative sleep that we also desperately need.
Absolutely. Well, and thank you for sharing too that element of the personalization. In my case, some of the peak stressors were happening while I was traveling. So I might be in different types of Airbnbs or hotels or what have you. And so I would just be doing such odd things. Like I'd be getting out of the bed and going kind of at this like little section, but not a proper second room, and overthinking, is this okay? Just all of this silliness. And I say silliness because now I can say that, but at the time it was so real and so just fear-based. So thank you for walking through that, and also kind of calling out that there might be specific ways we address this for different individuals. So to continue on, I'd love to hear from you to share more what else you see for people that are dealing with this big umbrella of anxiety. And of course, I know you had broken that down to many other things that might be happening for individuals under that umbrella, but if you want to just kind of share some other ways that you might steer this ship.
Yeah, totally. And this dovetails with when you mention acceptance and commitment therapy, we also can talk about mindfulness, which is a component of ACT, which is just being aware in the moment without judgment, but importantly, this element of control. Okay. We see this in anxiety. We see it in trauma. We see this all over the place. And in sleep, one of the most common things I'll hear is, Brian, I just can't shut my mind off. I can't turn my brain off.
Yeah.
And when I hear that, what I'm thinking inside is, good, stop trying to do that. Because, so another exercise we can play around with is, we won't take too much time, but so for the next 60 seconds, and audience members, you play along, Molly, if you will too. So you can think of anything that you want to think of. Okay. Anything at all for the next 60 seconds, but just don't think about a purple cow. Okay. Anything you want is fine. We're not going to do anything. And all our job is just to observe what comes up. Okay. All right. Any questions?
No,
okay.
That's clear.
I'm going to hit begin. After 60 seconds, we'll hear a little alarm and we'll see how this plays over a podcast. But all right, 60 seconds and begin. So that was a minute. Molly, what did you observe there?
Oh, lots of ping-ponging to the purple cow and then back again. Lots of that.
Okay. And how many purple cows were you thinking about before we did that exercise?
No purple cows whatsoever.
Okay. And so, but when we think about what we make of this, okay, and it's really because we're holding a rule in our mind that we're trying to control thinking. And a lot of the skills here, when you think about mindfulness, and the center of the bullseye is really just recognizing a thought as a thought. And when you do this work, you can come to the understanding that, oh, these things just arise, right? They just kind of like a wave or clouds in the sky, right? When we watch these pass by. But the moment we have a rule and we try to control them, I can't have any thoughts at night. I'm getting in bed. I need to not, it's fine to think about things, but not about my insomnia or whatever. That's the purple cow. And the more we try to control thinking, it actually, not only is it not useful, it tends to have the opposite effect of having more of those thoughts come up. It's this phenomenon that is very well known. It's called thought suppression. The more we try to suppress it, the more it tends to come out. And so the alternative, just like you said with ACT and what you came to, is just being able to step back and notice these thoughts arising. And so the shift can be the goal from, I need to turn off my mind, I need to shut off my thoughts. It can be, I need to be able to recognize when I'm having these thoughts come up. And then once you can do that, that is a skill that so few people have, to be able to recognize a thought and not be lost in it. But then you can ask yourself the question, well, is this useful? And so if the thought comes up about, oh no, I haven't prepared for Molly, that can be really useful because that might motivate me to then write some stuff down.
Sure.
But if it's 3 a.m. and it's like, what was happening there? Maybe do I need to? If that's not useful, well, now you have the superpower of just being able to notice it without necessarily needing to control it. And so for anxiety and for so many other, when we talk about thoughts, that shift alone and building those skills, because that is a skill. Mindfulness is a huge skill, and it's like learning an instrument. It requires practice. But once you can do that, that shift alone can be a game changer for so many of the people I work with, when that kind of cycle of, just thinking over and over and never moving past, that can be a very useful tool.
Oh, fantastic. Is a purple cow a nod to Seth Godin and his?
It is actually.
Oh, fantastic.
Yes, that's
Love
amazing
him.
that you. Yes, I think like a yellow Jeep. You can also use. You can use anything. But
Yes.
for me, I just get an internal smile when I think about. So Seth Godin, author of This Is Marketing, and he's very aligned with values-based.
Absolutely.
And Seth was a big influence on setting up Honest Sleep. My practice
Really?
when we did it. Oh yeah. I listened to.
Fantastic.
I was going to say I read, but I have him read me his books.
That's
Audiobooks, yes.
one high point of my life was meeting with him at a wedding. And I happened, he, asked what I do and what have you. And I shared about sleep as a skill. And he said, that's a great name. And that from a marketing master was like, all right, we've made it.
I always have a smile, and I love that we live in the world when we have Seth Godins and people like that. It's great.
Yeah. Oh, fantastic. Well, I didn't mean to sidetrack us, but I loved a mutual love and admiration. So that's great. So thank you for sharing that. And you might have already touched on this, but I just wanted to underscore, because I actually have a client in mind as you were sharing some of this, who often will speak to, has quite a narrative that she cannot meditate. She cannot think of those thoughts. She cannot sit with that. She needs to have TV, audiobooks, all the things because the moment she starts doing that, she gets more anxious. This is her narrative. And, I think you might have addressed a little bit, but I just wanted to super underscore that. What would you say from the vantage point that you're speaking to from CBTI, ACT, et cetera, to address that?
Yeah. So the comment, I can't meditate.
Yes.
Well, then the question is, well, what do you mean by meditation?
Yeah.
Okay. And very often people will say, well, I can't clear my mind. And now we're talking about, okay, well, let's talk about what meditation and especially what mindfulness is, which isn't about doing. We're not changing anything.
Sure.
We're just noticing what's already arising anyway. And so if then you tell me, well, I can't do that. When I don't have a distraction, I just notice these things are coming up. Very often, that is the first sign that, you're meditating. Like you're becoming aware of what is just happening automatically when we're on autopilot. Thoughts are just arising, and there's a lot of them. and then they lead to emotions, and then they lead to urges to do things. And if we can just step back as the observer and just notice that, we're going to be awareness, not the contents of consciousness, that can bring this freedom of, oh, I'm not really implicated in this. And so I'll do an exercise called urge surfing, which if you think about surfing, these things, you can view them as a wave. Okay. There's an urge to act when we have a thought of, oh no, did I lock the door? Well, the urge is I need to go check it. What would it be like to, instead of acting on it, just noticing that? I'll have people do this. We won't do it here, but I'll take 3 minutes, 5 minutes and say, we're going to commit to not moving a single muscle for this amount of time. We can still breathe, but if you have an itch, I want you to notice that urge to scratch it. Okay. If you have anxiety come up, what is the urge that's prompting you to do? And you can actually learn, and none of this is to be believed for the listeners. This is all to be tested. If you have an itch, just notice what happens if you don't scratch it. Does it keep increasing? Does the wave, how long does that last? Does it shift and go to some other sensation? Or does it kind of peak and then it naturally goes down on its own? You explore this, and then you can come to the curious question of, oh, everything kind of has this characteristic to it. So to that person, I would experiment with it. I wouldn't try to convince her at all. It's like, let's test this stuff out, and how interesting. Yeah, there's a lot going on in the mind. There's a ton going on, and that is really anxiety provoking. What does that anxiety feel like? How do you know that's anxiety and not fear? How do you know it's not shame? And now we're talking about, oh, there's muscle tension. Well, where is it? It's in my chest. And so we're kind of stepping back. Anyway, yeah, being very curious, being very open. But that's a common thing that I hear is I just can't meditate.
Yes.
And then it's about, well, what is the goal? And if the goal is to eliminate thinking, I can't do that either. And when I try, it's a nightmare. It's very counterproductive. No pun intended with the nightmare. Sorry.
Yes, exactly. I love that. Fantastic. So thank you for walking us through that and for giving so many of those tools. Are there any other tools or things that you'd want to make sure that you share about when you, and I know this is certainly thin slicing all of your wisdom in this area, but anything else that you want to make sure that you address when it comes to anxiety and sleep?
Yeah, if there is one tool that we have in the sleep, the toolbox that we have when we talk about anxiety, we talk about insomnia, which is people will talk about a stable sleep schedule. We want stability and consistency. I really want to emphasize a consistent and stable wake time.
Yes.
Okay. So when I'm working clinically, one of the first things we'll do is, yes, we're going to start tracking your sleep, but let's pick a wake time that it doesn't feel punishing. You're not swearing at me in your mind that I'm making you wake up 2 hours earlier, but what is the latest wake time that you will feel comfortable? Ideally, if you work on work days and on non-work days, but to have that set wake time. And then when I ask people, well, to say, why wouldn't I do that for my bedtime too? And I don't know if you have thoughts on that. Why would it be not advisable to, let's say, schedule a preset bedtime as well as a wake time?
Oh, I'm so glad you're addressing this. And this is one of my favorites too. I think certainly, especially in this conversation of anxiety, that the structure and the thoughting that can go into this when you don't achieve what can almost go into the realm of performance and certainly get kind of collapse with, oh, I already failed. You know, it was supposed to be 11 and now it's 12 and here we go. And then we can start kind of negotiating and a number of things can happen. And then you might think that it makes all the sense in the world to then push out that wake up time because you already missed the first thing. So you're already behind and what have you. So thank you. Yeah. Share more about that.
No, that you've hit it on, that is the center of the bullseye, which is if people focus on, I need to be in bed by whatever time it is. Normal people, quote unquote, sleep by 11 o'clock, but you might not be biologically tired until midnight or even if it is 11 o'clock, now you've set up that you have to strive to now will yourself unconscious by this predetermined time. We're watching the clock, we're getting stressed. And so by focusing on wake time, if we can consistently do that, and the important thing is regardless of how much sleep you got that night.
Yeah.
People, this can be very counterintuitive, but even if you get 5 hours of sleep, 4.5 that one night, if you hold that wake up time, well, now you have the whole rest of the day to continue to build up that daytime sleepiness, in the brain, adenosine, that primary molecule. And we can now apply that to the next night. And we're going to be letting your biological sleep drive dictate when you're getting into bed rather than that preset time, with the exception of if there's a trauma history and there's that really high hyperarousal, that might be masking the sleepiness. And so even if you don't experience it, the suggestion might be, okay, well, let's just try for this time, even if you don't experience sleepiness. And then if you're not falling asleep and you're efforting, there's that sleep effort, then get up and out. But yeah, set wake time if you can do it. It helps to be working with somebody to kind of hold you accountable because it's tough to do. But this is what I did, right? When I was doing for my own insomnia, I basically had to become a sleep specialist to, get over my chronic insomnia. And it's been over 7 years now. But that one recommendation alone can really do the trick for people.
Oh, so good. I'm so glad you addressed that. And just one quick thing that you made me think of. Paradoxical insomnia and anxious patients. Anything to say about that as far as the perception of the amount of sleep that you're getting and any things to be aware of, or kind of fact checking the thought of, I didn't sleep a wink, and that maybe there was some sleep that was happening throughout the course of the night, and just kind of questioning our own narrative there?
Yeah, it's tough. And so when we do a sleep log, like that's a subjective report that you do. You wake up, hey, what's your best recall of when you were asleep, when you were awake? This notion of paradoxical insomnia, and they've done studies where people EEG on their scalp, they are sleeping, but their subjective report is, hey, I did not sleep. I was, awake during the night. And there's actually some evidence that in some people, they're in those lighter stages of sleep. They might report, hey, I heard that car alarm go off at 2:30, and there was a car alarm, but they were in these lighter stages. And so clinically, how I work with that is, let's go with your daytime functioning level. So if there is that still hypervigilance, hyperarousal, and anxiety, and maybe I was asleep, I don't remember waking up, or maybe there's a disconnect, well, I'm really going to lean into the stress reduction, right? Elements of this, decreasing hyperarousal. And I don't often go to other tools like trackers, because when you go to sleep stages, a lot of people,
they're notoriously,
some can be, they can be good for sleep duration and timing.
Yes.
But a lot of people I work with actually not counterintuitively, but by them actually taking off the external commercial device they have, now they're not worried so much about the sleep stages. What we really focus on is, well, how do you feel in the morning? And so we're monitoring their level of restoration, and we're tracking sleepiness versus fatigue. And if we still see that kind of high, then we're going to adjust and say, okay, did we miss anything? We should still be having that go down. But that can be complicated when there's that mismatch, especially if it's a subjective report we're relying on.
Sure, absolutely. Thank you for distinguishing that. And as far as the trackers too, because I know a lot of people listening, because we do make a particular emphasis around technology and kind of data tracking. So for anyone that's listening, one of the important things that we like to really underscore is that of all the data that you're getting out of a lot of consumer grade trackers, the least accurate is the sleep stage classification. So we actually advise people to really not spend a lot of time looking at that, if at all, and actually avoiding that entire section. And if anything, utilizing that for a couple other reasons. One, kind of just the auto logging, the automaticity of when did I fall asleep around, when did I wake up around. But we also look quite a lot at more of these kind of quote unquote readiness indicators to pull from certain trackers. So looking at heart rate variability as far as a stress response, and then a bit of body temperature, certainly for women and their infradian rhythms and how that plays a role in their sleep, and then respiratory rate and some of the things that we can learn about through that. And you're so astute to pull out the point that sometimes there can be a time and a place for all of these things. And there might actually absolutely be benefits to taking a breather from all of this awareness. Maybe we're too aware. So I appreciate that call out.
And the center of the bullseye we can do is when we talk, instead of what should I or shouldn't I do, just give me some tips, give me some hot tricks. It's really about, we'll test it out and find out what works. If for you, your sleep tracker is useful, we're going to use that. And trust me, it's been useful. But if there's that, like you're saying, if we're way maybe over focused on it, well, we're not going to say take it off and don't use it and throw it away. We're going to say, what would it be like for this week?
Yeah.
to maybe
Absolutely.
take that off, and they get an anxiety spike. And it's like, well, let's talk about that, right? What would it be like not to have that data and to rely on, this is mindfulness, to rely on those own cues and signals. And again, we're just being flexible and doing what works.
Fantastic. Okay. So from that place, we want to dive into what is it that you're doing for your sleep? Because you've so generously shared that you've worked through a lot of things and had some real triumphs in your own sleep. So people often want to say, well, what are they doing? So we have 4 questions that we ask everyone that comes on. So the first one is looking at, what does your nightly sleep routine look like right now? And I'm sure it's evolved and changed, and travel or whatever might adjust it. But what would we see now?
Yeah. So a really, really, really big thing that I used to really struggle with until I realized how counterproductive it was is I try to finish work at least an hour before I typically get in bed. Currently, I'm getting into bed about 11 p.m. I really try 10 p.m., if not earlier, to get the actual work done, not to be emailing, not to be otherwise engaged. So again, I really prioritize that pre-sleep buffer period. So I try to complete work. And by the way, sometimes I slip up, but I know what I'm doing. I know that's setting me up. And then I'm increasing these other things, which is I will do so many of these relaxation techniques. I have over on the external monitor, I have my daily Word document. I know what today is going to be after I see patients today. I'm going to know what tomorrow is. If I have any worries, I'll write those out and try to problem solve it, because that cognitive thinking piece was huge for me. So I will do that. And then in terms of relaxation, a meditation practice has been for the past 7 years. It's just a daily practice that I have. It's incredibly useful for me. Sometimes a hot bath, that when we talk about core body temperature, when we get out, it dumps that core temperature to the environment. Core temperature decreases. That's useful. I'll often do stretching. I hold a lot of tension in my neck and my shoulders. Yeah. And so I'm doing it now because I'm aware. Let's all stretch. But it can be really interesting how it seems like these little interventions of stretching, and I'll do this paced breathing. And often too, it's funny, Megan, my wife, she'll see me either meditating out back or during the day, and I'll just have my finger on my neck. Great. And she's like, oh, are you doing your paced breathing? I'm like, yeah, you know what I'm doing. But just to get that feedback of, hey, my heart rate, I'm slowing it down. So I'll do that. And one thing we haven't talked about, but it's been a staple for me for so long, is I use a white noise machine. Every night. Yeah. And that has been really, really useful. There'll be days where I don't have it and I can still it's been a process. I don't necessarily need it to sleep, but it's part of my routine is I'll just click that on and I have that. That helps with thinking for me, right? For some people, it doesn't. Absolutely. It's useful. And then always when I'm in bed, if I have that sleep effort, I'm getting up, I'm getting out of bed, I'm doing the relaxation tools, and I'm getting back in bed. I don't even think about it anymore. It's just so natural that I've done this for 7+ years now. This is just what I do. If I have that sleep effort, that's basically the routine.
Oh, so great. And the meditation piece, any call outs there as far as, so some people discuss benefits or call outs around doing it right before sleep, like if you fall asleep and it's almost like giving you a second wind, or do you find that that's not the case and it just kind of calms you and gets you prepared for sleep? What's your take there?
I would say, again, I'm going to default to let's test it out and let's try it out. For me, I'll do in that pre-sleep period, it's useful. And I've really transitioned from what we can call a formal meditation, like we kind of did, for a couple minutes here where we're sitting down, eyes closed or open, and really having this just be more of this informal, this is how I kind of am. Like I'm doing it right now. I'm aware of you, I'm aware of the surroundings, but when I notice I'm lost in thought or I notice these emotions, that's kind of a mindfulness alarm of, okay, what's happening? And so I would say for people just getting used to this, just try it out. I have a couple of apps that I usually recommend. 10% Happier is great. Dan Harris, the free trial. Great. Waking Up with Sam Harris is my favorite. So good. Just because he has the evidence-based neuroscience, mindfulness, and all of that background. Calm is good. Just test it out. But I would say, none of this is, again, to be believed. Is it useful for you? And then figuring out what times of day especially around sleep, it's working for you. And see for yourself. Yeah, I love that.
Andrew Huberman has kind of popularized the whole non-sleep deep rest protocol, as he's coined it, which I appreciate as just kind of a container to put a lot of things that might calm the nervous system and kind of put the brakes on that stress response and sympathetic response. So it might look like different things to different people. Yoga nidra, it might be hypnosis, it might be deep breathing, yoga, whatever. So the fact that we can pull out all those and, to your point, get curious and practice and experiment for ourselves is really empowering.
And just one thing there is we haven't talked about nightmares, and we don't have time to do that today, but part of the nightmare protocol is actually doing these relaxation exercises while you're in bed. After you do some of the imagery rescripting and all of that work for nightmares, when you're in bed, now you're doing progressive muscle relaxation. Now you're doing the breathing. So again, no hard and fast rule that it's just like you said, sleep and sex. Yeah, those have a lot of evidence, but test this out and see maybe it is in bed right before sleep. And a lot of the patients I work with on trauma-related nightmares, they start doing it. And before they know it, they're waking up in the morning and they have no memory of what happened. It's great.
Oh, that's incredible. I mean, I know I'm kind of biased, but it's just such an example of how life-changing something like this can be when someone begins to entrain themselves to be really sometimes terrified to go to sleep, and how it relates to their bed and to recreate that is just huge. So thank you for that. So the second question that we've recently added in is, what is your morning sleep routine? And I think you certainly alluded to the fact that we know most likely yours is going to be consistent and it's going to be around the same time that you're waking up, which is fantastic and it's kind of step one in a lot of ways. So anything you want to share about what your morning routine looks like and how you see that relating to your results with your sleep?
Yeah. And so before having kids, I used an alarm for the set morning wake time.
Yeah.
We have four, we have a 7-year-old, a 5-year-old, a 3-year-old, and a 1-year-old, which has been fun during a pandemic. It's been great. It's been amazing. But 7 a.m., regardless of whether I want that or not, is the latest I'm ever getting up because they're jumping on the bed and they're there.
Totally.
And so a consistent morning wake time, it doesn't matter what day it is, that's when I'm going to be getting up. If it wasn't for them, I would set an alarm. And for me, it used to be I had the coffee pre-programmed in the morning as kind of that emphasis to get up and out of bed quickly. Now I have the tea, the kettle kind of ready. I can do that.
Great.
For a lot of people I work with, having something that's motivating you to get up and out of bed, whether it is a certain beverage or whether it's a certain activity I want to read by the window, that's really useful for me to know there's that set thing to look forward to. And then just so happens I'm a creature of habit. A lot of my morning routine is very, very locked in about making breakfast for the kids, making breakfast for me, taking a shower. Like there's an order to it and a predictability that, again, it's kind of out of my hands now. It's just automated at nighttime and at the morning. So that's consistent wake time is the center of the bullseye for sure.
Fantastic. I like that. Consistent wake time. And then you're also getting that consistent meal timing in there, which is fantastic also for entrainment of our circadian rhythm. So really good stuff there. And then the next question would be, what might we see on your nightstand or maybe your proverbial nightstand if you're traveling? Anything that you would often ensure is around you? I know you mentioned the sound machine, but if there's anything else.
That is my primary one.
Okay.
So it's
fantastic.
The sound machine, and that literally is on my, not just proverbial, that is on my literal nightstand that I have there. And I silence the phone. I actually turn the screen down, which is if I get a message or anything, of course it's on silent, but I don't like any light, any distractions. We have a ceiling fan. I make sure temperature is cool. For us, we've settled on like 69 to 70 degrees, but temperature is huge. Not exactly on the nightstand, but that's something we prioritize. But yeah, kind of a minimalist. I don't have too much there but the nighttime routine leading up to it is kind of the central driver for me. Yeah.
Oh, fantastic. Okay. And then the last question would be, what has made the biggest change to your sleep game or the biggest kind of aha moment that you've had with your sleep? I know you've already kind of shared a bit of your journey, but if there's anything that sticks out that we didn't discuss.
Yeah, for me, the biggest aha moment was there is actually a field that's devoted to sleep medicine and treatment. Yeah. I had never heard of any of this stuff that we're talking about. And for me, when I learned of it, I had been trying so many things. Again, it was Ambien, it was Benadryl, it was alcohol, it was like NyQuil, it was whatever I could do. And when I talked to my general practitioner, it was just, well, here's some meds, here's some sleep hygiene. And so on kind of accident, again, thanks REM for getting into an eye-opening, opening my eyes to this field, just learning about the evidence and that this actually is the gold standard treatment. And sleep is a skill. These are skills that can be learned and that can be practiced. And very importantly, that can be individualized. If you're frustrated by trying the 29 things that people have been recommending to you, maybe only 2 of those are going to be useful for you. And so giving yourself permission to focus on what works and maybe not to focus so much on all of the things you're hearing. But that was the biggest game changer for me, is those 4 letters, CBTI. It completely changed my life. And I mean, my career trajectory is what it is because of it. It was so incredible. And that's why I'm so passionate about this work, as I know just how life-changing this can be. And I really appreciate you, this podcast, because that really is a barrier, is just getting the word out and having people to become aware of not to be hopeless. And there is so much science behind this, and getting started can often be the hardest part. So yeah, that was the biggest thing for me.
Oh, so great. Well, thank you so much for sharing your wisdom. Yeah, I was really struck by your knowledge, but also just what felt like that real, genuine passion when we had connected on the panel that we're on. So excited to continue to collaborate with you in whatever way possible to kind of get this word out. And I appreciate too that you do speak openly about the mental health piece, because sometimes we can glaze over that, but that is just can be such a huge component. And we've only scratched the surface, I know, today, but really appreciate you sharing all this. So for anyone that's listening and they say, oh my gosh, I need to kind of follow Brian's work or work with you, what are some of the best ways to get connected or stay connected?
Yeah, I would say the website is just honestsleep.com, HONESTSLEEP.com. And whether or not you decide to work with me, whether or not you have questions, please feel free to reach out to me. I love getting those emails about, hey, this has been happening. What do you think? Because again, getting people on that path can be such a critical step. And so Brian, BRIAN, at honestsleep.com. Do not be shy. Please feel free to reach out to me with questions or anything else. And you now have a sleep specialist in your back pocket. And I genuinely, sincerely would love to hear from you. So don't hesitate if this sounds like something that would be useful for you. Yeah.
Well, anyone listening, absolutely take advantage of that. You don't hear that every single day. And then to that point, I just wanted to check into, I love what you said about getting people on that path. If people are just beginning, they're curious, or maybe they're on the spectrum of desperate, wherever they might be falling, wanted to hear, do you have any other first steps that you often recommend as far as books or places for people to begin? Because I know you said CBTI for you really made just such that difference. Just wanted to check in if you had any resources that you really recommend there.
Yeah, I would say a really, really great one is the Society of Behavioral Sleep Medicine and their website. It's behavioralsleep.org.
Okay.
That has really like an overview of what this field is about. It'll talk about CBTI. It'll talk about nightmare disorder. It'll talk about circadian rhythm disorders. If you have sleep apnea and you can't stand wearing that mask, or you have claustrophobia or a trauma history, a big evidence-based thing you can do is to work with, a behavioral specialist to be able to get used to that and habituate to it. And so that can be a resource to kind of explore around. In terms of books, I don't have it in front of me. It's Colleen Carney, and this is for clinicians too. I would say it's called Treatment Plans and Interventions for Insomnia. That book alone, it really walks you through kind of the nuts and bolts if you wanted a deep dive into sleep treatment. And I would say if somebody just wants to get started, let's say insomnia feels like kind of the flavor of what they might have, the VA has put out the CBTI Coach app.
Sure.
And so you can just go and type in CBTI Coach and download that, and it'll actually kind of walk you through, this is what CBTI looks like. Here's some of the components. So you can start testing some of this out for yourself.
Well, thank you for answering that question. I've been playing with adding that to a fifth question that we ask everyone as far as kind of their most recommended or resources and places to begin for people. But absolutely, I don't want to step over the fact that you're offering to be able to kind of help people along on this process, if they do have anything specific to reach out to you, please take him up on that. That's very cool offering. And I just thank you for your time and your attention and just generously giving this information to all of us, which, as you've shared, I completely agree, can be completely life-changing. So thank you for what you're doing and looking forward to more.
Well, thanks so much, Molly. Honestly, truly a pleasure of mine. And thanks for all the amazing work that you're doing. And thanks to everybody for listening.
Fantastic. Thank you. You've been listening to the Sleep is a Skill podcast, the #1 podcast for people who want to take their sleep skills to the next level. Every Monday, I send out something that I call Molly's Monday Obsessions, containing everything that I'm obsessing over in the world of sleep. Head on over to sleepisaskill.com to sign up.